I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration. Today, we're getting a look into Iowa's 2023 drug control strategy. The Iowa Office of Drug Control Policy is the trusted source where parents, teachers, prevention, and healthcare professionals can get the resources and answers they need. Now, today we're talking with Dale Woolery from the Iowa Office of Drug Control Policy, who's at the front line of our defense against substance use disorder and addiction. Dale, welcome to the show. Tell us about what you do and the importance of this new strategy for next year.
Well, thank you, Peter. Every year our office, along with a lot of other people, put together a state drug control strategy. And it's twofold. It's to look in the rearview mirror to see where have we come from and where are we at right now, but also to look over the hill in front of us and try to prepare for those things that are coming now. It might be new, might be changing. And so we're looking kind of back and forward and taking a look at where we're at with a lot of different data indicators and inputs from a lot of different organizations, individuals, communities around the state. So it's really a status report, but also gets into promising approaches to address those challenges that are out there. And so it takes a comprehensive approach, looking at the need to be hitting on several fronts. There's no silver bullet for preventing substance use or misuse in the state of Iowa. At least that's the premise on which our report's based. So it looks at preventive methodologies that work, intervention and treatment methodologies that work, as well as enforcement mechanisms. So we're attacking the demand side of substance use, as well as the supply side in a comprehensive and high-level fashion. This is really a blueprint for action across the state, and it helps to identify common priorities and common effective responses so that hopefully we can be effective in what we do collectively.
You know, every year we try to do a show every year because of the approach that you have and how important it is to people. And I remember last year how many parents and teachers said, you know, this was a really interesting website to go to. Looking at this report, it gave them a feel as if they got a over the top sort of view. I know we're going to share the website and the link, but after all, your grandparents and people putting this together are parents. When you look at this, what is the sensitivity to not just the administrative side and the state level side, but the community and parent and child side? I mean, where would a normal person, an average person with curiosity into what's happening with these problems, how would they target looking at your report?
Well, I would start by saying that there is no state strategy without community needs, ideas, solutions, efforts. It's based on that. So there really is no such thing as a state issue. These are local issues, and they vary. I try to get out and listen at various town hall meetings and community forums. We talk to a lot of people during the course of the year. It's an ongoing process. Takes the full year. It's a combination of meetings, conversations. We get phone calls, emails, and we invite all of that because it's all important. And you never know, you can't predetermine anything. And there's a lot of data, a lot of research that goes into it as well. So, I mean, that's outside of what we hear from Iowans in communities across the state. But it also tries to keep us on track because we believe you should follow the science. Sometimes there's not a consensus on what the science is telling us, or different people have different, I guess, interpretations. But in some cases, we don't have that conflict. It's pretty clear. And so we like the science leading, and then we try to follow, but we do it in a way that's in the context of Iowa community needs.
Well, based on that context, what are some of the eye-opening things you've seen maybe change or grow in stature from last year to this year?
Well, a few high-level just issue areas. One, we have many more substances that can lead to intoxication, impairment, addiction, overdose. And so the playlist, if you will, has gotten longer. The substances are being used in combination more often than used to be the case. They're more potent. And these are things we don't have good science to tell us a lot about, because when it's new, I mean, science takes a while. And so the higher potency is one of those things that we're concerned about, but we don't have a bevy of science in every case to back up why or how we should be concerned, exactly what that means. But, more is not always good when it comes to the potency of these substances that can lead to these problems. So and the speed with which everything is changing, and the access with which young Iowans and all Iowans have to these intoxicating, impairment-causing addictive substances. And a lot of that's driven by the internet, but it's not just the internet. We just have many ways in which people can get to these substances, and the way these profiteers can actually get to Iowans when it comes to marketing even black market substances.
Well, we're going to take a short break and continue our conversation with Dale Woolery and take a look at exactly what some of these substances are that concern us in Iowa communities. See you all after the break. You don't want to miss this.
The black truck? Hey, Christina from accounting.
Yeah, hi.
Hey, I used to date a girl named Christina.
Oh, really?
Yeah, and then she dumped me for my best friend. You want to see some photos of them that I took?
I don't.
I thought we talked about this, buddy.
Buzzed and overshared again?
Yeah.
Yeah. I'm gonna call a car.
That's a smart idea.
So yeah, I know, that's why I did it.
Hey, you're gonna get back to the top of the mountain.
Does that mean I'm gonna get back with Christina?
No.
Oh.
No.
Welcome back to Surviving That. I'm your host, Peter Komendowski, and we're looking at a problem that America has fought valiantly to try to prevent: substance use disorder and needless deaths by overdose. You know, we work hard to cleanse our communities of these dangerous substances that threaten the health of our children. And we need some more information to know what we need to do as parents and as teachers and as community leaders. We're talking with Dale Woolery from the Iowa Office of Drug Control Policy about some of the challenges our communities face. Dale, tell us about what some of these problems are that are emerging now that we need to deal with.
Well, some people might already be familiar with this, but kind of at a general level, when we look at some of the substance types, bottom line, the glass is half full and the glass is half empty, where we have some mix of progress and challenges. For instance, we are challenged in particular with alcohol and nicotine, where we tend to use as Iowans generally above the national average. So our rates of binge drinking and excessive drinking are among the highest in the nation, whereas nicotine use in Iowa is a little above the national average. Contrast that with the fact that we are relatively low. We're at the other end of the spectrum when it comes to rates of illicit substance use. So the use of marijuana, use of heroin, cocaine, methamphetamine, generally and overall, big picture, we have relatively low rates of use and of overdose death. That's not to say we don't have issues. I don't mean that, but in context, which we find helpful just because people want to know how do we stack up with others, there we're doing a little better. And importantly, and I think interestingly, when it comes to young Iowans, the data we look at shows a continued steady or slight decline in the use of various substances by Iowa youth. What I would say also is that when you look across the spectrum of different substance types, again, those that can cause some form of intoxication, impairment, mind-altering substances, essentially. Alcohol continually and historically has been at the top. It's the most available, most consumed, and I think most problematic substance, no matter how you look at it. After that, marijuana is one of those fairly accessible substances. And then methamphetamine, it appears that, again, in comparison with other states around us, maybe not as big of a factor as it once was. But I will tell you, based on what we hear from law enforcement, there is a lot of methamphetamine flowing into the state, and it's a very addictive substance. So a lot of it's being used. And I want to throw in the mix that, vaping, while during the pandemic, we didn't hear as much about it. It's not gone away, and there are indications that there may be a bit of a resurgence in some of the vaping in certain sectors.
Yeah, we've seen some reports that the 12 to 17-year-old use of vapes is as high as 50% in some states with marijuana products, that they're quickly gravitating from nicotine to marijuana with the product, or migrating from marijuana to using a vape with marijuana. That's unknown yet. But we also see a burgeoning sort of fentanyl problem, especially amongst the innocent. So I shouldn't say innocent. They're often young children taking things they think are pharmaceuticals from legitimate sources that are counterfeit and deadly. How is that? What's happening with that in Iowa?
Well, that's the most troublesome emerging issue, the opioid misuse. So it's the latest phase of the opioid epidemic. We went from prescription pain relievers being the big problem there, to heroin, and now it's fentanyl or substances, and it can be just about any substance laced with fentanyl. And so fentanyl has become kind of the salt or pepper to a lot of different substances, but that's way underestimating or understating the danger. It's a very lethal substance, and we're talking about non-pharmaceutical fentanyl, not the kind you get in a patch prescribed by a doctor. This is black market, illegal, and highly lethal fentanyl and fentanyl analogs and other synthetic opioids. Fentanyl is a synthetic opioid. There are many others by different names. Some are in the fentanyl family and some are in other families. Chemically, there may be a difference, but practically speaking, the important thing to know is that it could be anywhere and it can kill you. And unfortunately, it's doing that. The latest trend, if you will, we hope it's a fad, is fake or counterfeit pills made to look like prescription medication or some other pill, but with fentanyl in it. And tragically, we're seeing more and more young Iowans, including teenagers, who are taking a pill thinking it might be a prescription pain reliever that will get them high. And unfortunately, it's got fentanyl in it, and it does much more than that. It kills them. And that is very bothersome. That's something we certainly need to try and get a hold of. We're going to need help, though, because this stuff is coming from out of state. So we've got to work hard in Iowa, but we also need help from outside of Iowa to control the source.
Yeah, and one thing we've heard too is that when we talk about fentanyl being used legitimately, it's in very, very severe instances of pain, hospitalization, hospice, and people are dying. This is not a commonly prescribed medicine. So in no way should somebody think it's safe to use without a doctor's oversight. Well, we're going to take a short break. We come back, we're going to talk to Dale a little bit more about the science behind their work and how they bring resources together that you can access on their website. See you all after the break.
Multiple studies have shown that marijuana can slow both driver reaction and response time, which can be really dangerous. He's here. He's here.
Wait.
Why?
I can't drive.
Why?
I'm high. Oh.
Not all internet is priced this good. Switch to Extreme and go super fast for as low as $19.99 a month for a year. Oh yeah! Hook up your home with powerful Wi-Fi, 99.99% reliability, and speeds that are FCC proven to be faster than advertised. Not all internet is priced this good. Switch today and get speeds starting at 100 meg for as low as $19.99 a month for a year. Call 844-EXTREME2 for details.
Welcome back to Surviving Bad. We're talking with Dale Woolery about the numbers, the science that reveals the truth and consequences of drugs and other dangerous substances. Dale, let's pursue that course of action. What do you have to share with us?
Well, we as I said earlier, we try to follow science, but we also follow data. They're often linked, but the data gives us kind of an indication of what's a hot button need. And so, for instance, when we look at hundreds of data sets here in Iowa, one of the things we watch most closely right now, given the fentanyl issue that we talked about, are overdoses and overdose deaths in particular. That's not the only indicator of what's going on, but it's one that, as you would expect, affects a lot of families very deeply. So I'll just share some figures here. This is from 2021. We had a 38% increase in alcohol-related deaths. They're over 800 for the year. That's a variety of ways in which alcohol can be a factor, from poisonings to disease, which is the biggie, but it's also car crashes and other alcohol-related activities. If you look at opioid overdose deaths, and these are just toxic overdose deaths, opioids are the big driver of the drug overdose death, 64% increase. Stimulant overdose deaths, primarily methamphetamine, up 20%. And if you look at the age breakouts among our young Iowans under 25 years of age, if you look at the opioid overdose deaths, it's up 290%. Now, it's a small number, relatively small number, but large increase. So, you know, that's part of the context we have to look at, is that, okay, we started low, but we're going in the wrong direction. And a lot of that, I think, are the counterfeit pills. We also look at the science when it comes to, you know, for instance, on marijuana. I'll just use that as an example, because there's a lot of debate about marijuana, and we're getting more and more studies and research, whereas we didn't used to get that much. And that's the biggest need, in my opinion, on marijuana, is we need the scientific community measuring therapeutic values, impacts on health, impacts on public safety, good, bad, indifferent, and if it's good, for whom, under what conditions, and if it's bad, for whom and under what conditions. And so I don't want to get into the weeds on that, because there's a lot you could talk about. But recently there was a study in the British version of the Journal of the American Medical Association, called The Lancet, that showed, you know, there's harm to others related to marijuana use, especially with the more potent versions of marijuana, where you have more vehicle crashes, interpersonal violence, secondhand smoke, and issues involving pregnant individuals smoking or using marijuana.
You know, I have a question for you.
Yeah.
In looking through your report, if I remember correctly, did I see that amongst a certain age group that the alcohol and marijuana influence on traffic fatalities was closing into being about equal, 50-50?
Well, I think nationally, they've seen an increase in the drug-related traffic crashes, with marijuana or you know, cannabinoids being the leading type of drug. And so I don't recall that one's overtaken marijuana has overtaken alcohol. But if you look at all drugs combined nationally, I think that was the case last I looked. Here in Iowa, I don't know that that's the case. I think alcohol would still be the market leader, if you will. But there again, we only know what we see, and we only see what we look for. And we don't have the best detection capabilities on all substances. So whether it's, some forms of marijuana or some of the different compounds, or even more to the point, some of the newer synthetic drugs, we don't have ways to even identify some of those when they first are developed and out for use. So we truly fly blind on a lot of these substances in terms of, okay, I said we like to follow the science. Well, guess what? When this stuff's breaking and being sold before we know what to call it, we don't have a lot of science to go on. So that's the biggest challenge I think those of us who work in this area face, and that is, how do we run faster to keep up with the changing marketplace and learn as much as we can, as fast as we can, so that we can provide information to educate everyone else, so that we can all be smarter about these newer and emerging drugs.
We're going to take a short break, and then we're going to invite Dale to share some final comments and advice. Stay tuned. You don't want to miss this. He's sort of an inspiring guy. Let's hear what he has to say after the break.
Today, more than ever, you need fast, reliable internet. At Mediacom, we want you to know you can count on us. Our fiber-powered 100% gigabit technology network was built for the future. We have enormous capacity and power and 99.99% network reliability. So even though these are uncertain times, we're prepared. And you can be certain we'll keep your world connected.
Not all internet is priced this good. Switch to Extreme and go super fast for as low as $19.99 a month for a year. Oh yeah! Hook up your home with powerful Wi-Fi, 99.99% reliability, and speeds that are FCC proven to be faster than advertised. Not all internet is priced this good. Switch today and get speeds starting at 100 meg for as low as $19.99 a month for a year. Call 844-EXTREME2 for details.
Welcome back. Today on Surviving Bad, we're talking about drugs, all those things that can hurt our children, families, and communities, and the people that work behind the scenes to make our world a safer place. Let's hear what final comments and advice Dale has to share. Dale, tell us what we need to do.
Well, thanks, Peter. I really think we all have a role to play, from talking with our children to taking back our prescription meds to safely dispose of them. I think we need to be quicker at what we do to respond. It's a kind of an all hands on deck type need to deal with the overdose situation, the potency, the polysubstance use, with the changes that we face. I think we need to focus a lot on improving the way in which we intervene. We need more pathways to get people to treatment. We need more pathfinders to help them get there. We can't expect everybody can navigate multiple systems, these complex issues that are getting more complex. We've talked about some of that here today. And so a lot of what we and others in the state of Iowa are doing is trying to develop ways in which we can deflect people who need help, not to get them not to jail, not to the hospital, and not left on the street, but to treatment. We also need to beef up our enforcement efforts because we need to do the best we can to interdict the supplies of these poisons in many cases. And I think first and foremost, I would underscore the need for prevention. That's the professionals and what they do in the communities, our schools, and so forth. We need help from media. And those of us who are parents and grandparents, and I would be in both of those categories, we need to be setting good examples and talking with our children and grandchildren, family members, those people we love. We need to have those conversations and keep having them, because that's one area where the research shows when young people are learning at home about the risks of drugs and hearing expectations of non-use, it greatly reduces the odds that somebody will take and make those risky choices. So we all have a role. I thank all Iowans for what they've done so far, and let's do even better going forward.
You know, one of the things that we do know is that it's very hard for a parent, teacher, people to be informed on exactly sort of what the state of Iowa is. And I am impressed. Your drug control strategy, which is like a comprehensive blueprint, as you say, for prevention, treatment, and enforcement, is good reading. I mean, let's face, I think a fifth grader can read it and get it, a sixth grader. I think a parent can read it and get it without professional training. We know prevention people live with it sort of in a biblical sense because it gives them a lot of data. I'm very impressed with what you put out. And now, how would you recommend people approach finding it? I mean, how, is it easy to find? I mean, they go right to your website, but reading it, I know is easy because I enjoyed it.
Absolutely. To get that report and other information, you can go to odcp.iowa.gov. So that's odcp.iowa.gov. I also want to throw out that if you are wanting more information about substance types and help that you can provide, go to yourlifeiowa.org. That's a helpline website that's there available 24/7. And ultimately, if you are in crisis, there is a new 988 number. So call that 988 if you or a family member are in crisis. And obviously, if you have an emergency, call 911. Finally, if you suspect that there's illegal drug activity happening in your neighborhood, call the local law enforcement agency and make sure that they know about it.
Dale, thank you so much for sharing this important information and resources with us. And thank you all for watching today. Check out our website at healthyiowa.org for more information. And keep your eye on Mediacom MC22 for our next episode of Surviving Bad, where we explore Iowa's stories of survival, hope, and inspiration. On Mediacom MC22, your local programming leader.